The resurgence of COVID-19 activity in the United States is becoming increasingly noticeable, and it's a situation that demands our attention. Recent data from the Centers for Disease Control and Prevention, CDC, indicates a significant uptick in SARS-CoV-2 detections in wastewater, which have escalated from low to moderate levels. This trend is particularly pronounced in the western states, with the South, especially Louisiana, reporting alarmingly high levels of detection. This information, shared in the CDC's latest weekly update, underscores a growing concern about the potential for increased COVID infections across the nation. The CDC's analysis of wastewater trends, alongside model-based epidemic forecasts, suggests that COVID-19 cases are either increasing or are likely to increase in most states. Other critical indicators are also on the rise. For instance, the test positivity rate has jumped from 6.5% to 8.6% in just 1 week, with the western and southwestern regions experiencing higher rates than the rest of the country. Additionally, emergency department visits related to COVID-19 have surged across all age groups, showing a 19% increase compared to the previous week, with many states reporting moderate to substantial rises. Interestingly, the number of COVID-related deaths has seen a slight decline in the most recent reporting period. In the realm of influenza, the CDC has reported a new pediatric flu death, bringing the total for the season to 267. This figure marks the highest number of flu-related deaths in any non-pandemic year since the disease became reportable in 2004. Alarmingly, 90% of the children who died from the flu had not been fully vaccinated, a stark increase from 82% in the previous season. Meanwhile, the CDC's monitoring of respiratory syncytial virus (RSV) indicates that its levels remain very low, providing a small silver lining amid the ongoing health challenges. A recent study published in PLOS One has shed light on the healthcare utilization patterns of U.S. adults suffering from long COVID. Researchers from Rush University Medical Center and Yale School of Medicine conducted a secondary analysis of a multi-center study involving adults with confirmed COVID-19 infections. They found that individuals with long COVID experienced significantly higher rates of hospitalization in the 6 months following their acute infection, compared to those who did not develop long COVID. In this study, participants were categorized based on their symptoms 3 months post-infection. Those exhibiting 3 or more persistent symptoms were classified as having long COVID, while those with fewer symptoms were placed in the non-long COVID group. The researchers aimed to compare healthcare usage between these two groups before and after their initial COVID-19 diagnosis. They categorized healthcare encounters into 6 types: inpatient hospitalizations, emergency department visits, office visits, procedures, telehealth consultations, and other types of visits. The findings revealed that nearly 850 participants, with a median age of 40 and a majority being female, met the study's criteria. Among these, 179 were identified as having long COVID. Both groups showed an increase in healthcare visits across all categories after their initial COVID-19 diagnosis, with a notable rise in office and telehealth visits. Interestingly, while the long COVID group had fewer emergency department visits, those with long COVID who had been hospitalized previously were nearly 3 times more likely to require additional hospitalizations compared to their non-long COVID counterparts. The authors of the study emphasized the importance of recognizing the potential for repeated hospitalizations among long COVID patients, and suggested that public health resources should be allocated to provide more outpatient support to mitigate the need for inpatient care. In other health news, Nevada health officials recently reported the detection of the measles virus in wastewater samples from Clark County, which includes Las Vegas. Although no confirmed measles cases have been reported, this detection serves as an early warning sign that the virus may be circulating in the community. In Idaho, a case of measles was confirmed involving an unvaccinated teenager who had traveled internationally, although the patient self-isolated during their infectious period and did not require hospitalization. Globally, polio cases have been reported in 3 countries, including Pakistan, which has documented another case of wild poliovirus type 1. This brings Pakistan's total for the year to 18 cases. In Africa, Chad and Nigeria have also reported additional cases of circulating vaccine-derived poliovirus type 2, CVD-PV2, with Chad's total now at 14 cases and Nigeria at 22 for the year. Moreover, the European Centre for Disease Prevention and Control, ECDC, has noted an increase in local vector-borne diseases across several European nations. France has reported 4 new locally acquired dengue cases, raising its total to 10, and has also identified 2 new clusters of chikungunya, bringing its total to 63 cases across various administrative regions. Meanwhile, Spain has confirmed an additional case of Crimean Congo hemorrhagic fever, a tick-borne illness, increasing its total to 3 cases. As we navigate these complex health issues, it's crucial to stay informed and engaged. What are your thoughts on the rising COVID-19 activity and the implications for public health? Do you believe enough is being done to address the challenges posed by long COVID? Share your opinions in the comments below.